Hi, welcome to the treatment group video for personality disorders. My name is Angelo Allegeretto. My client's name is Frank Young, and he's 32 years old. The differential diagnosis, since we have previously already ruled in that the client met the criteria for having a personality disorder, we only have one differential diagnosis, which would be antisocial personality disorder. There is one primary diagnostic feature, and it is lifelong pattern of disregard for in violation of the rights of others, which manifests in behaviors that are impulsive, outside the parameters of social law, and more in a lack of responsibility. A little bit about Frank's story. He was born to a mom who was a prostitute and a drug addict, and he didn't know who his father was. He has had a long history of very serious behavioral problems. He began getting into physical fights with children beginning in kindergarten. As he grew older, he constantly bullied other kids, which resulted in multiple suspensions and ultimately his expulsion from numerous schools. He was caught torturing animals on a number of occasions when he was in elementary school. When he was 10 years old, Frank threw his baby brother off a window of the first floor apartment, causing his brother to have multiple fractures. After the incident, he was removed from his home and sent to a group home where he lived for several years. Occasionally, he would end up staying at his grandparents, who had to take up care of 6 other grandchildren. Frank then started using drugs at the age of 12. He fathered his first child at the age of 14, and before he was 17 years old, he was arrested on a variety of charges that included theft, possession of illegal drugs, and assault. But because of his age, he received a series of suspended sentences. By the time Frank was 25, he fathered 6 children, none of who he sees or supports. Frank is a very manipulative person who can be very charming, funny, and sociable. Other than that, the last occasion was he was recently hospitalized, and he was caught having intercourse with a 60-year-old female patient at the hospital. And that's pretty much it for Frank's story. Now for the multi-axial diagnosis. For axis 1, we have none. Axis 2, we have antisocial personality disorder. Axis 3, we have suicide attempts. Axis 4, we have unstable family environment. And then Axis 5, the GAF score is 25. There are 3 biological perspectives. Three theoretical perspectives. The first one is a biological perspective. And that states the symptoms are described by maybe having a genetic predisposition, abnormal brain structures, in particular an underdeveloped prefrontal cortex, and a deficit of the neurotransmitter serotonin. The second theoretical perspective is the family perspective, and the structural approach is playing the role in this perspective. When he grew up in an environment where there was no structure, and he wasn't able to find a role model that wasn't holding him accountable of the expectations of law, and grew up being able to do whatever he wanted with no punishments. And then finally, the last one is the behavioral perspective. There are 2 faulty learning systems due with antisocial behavior, which is observational learning and operant conditioning. For observational learning, when children's parents partake in criminal behavior, it teaches them that it's okay to act like that in life. And for operant conditioning, when he engages in antisocial behavior and not getting in trouble for his action, he's being negatively reinforced because by avoiding accountability and also being positively reinforced because he feels mastery over other people. And that wraps up the treatment group video.